My tooth's not hurting, so do I really need that crown right now? Here's 3 reasons why you might not want to wait to get that tooth protected.
Down in Brookhaven, with a smile shining bright, Dr. Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.
As a fellow human being, I can understand if something's not hurting or not causing you pain or discomfort, there really is not a lot of motivation to get it fixed. But I want to let you know the reasons why putting this treatment off might raise bigger problems down the road. Number 1, if a tooth has a large filling, it might have small cracks and the tooth is starting to break down. And while this might not be symptomatic to you, you might not feel it. Unfortunately, a lot of times those dental cracks will undermine large parts of the tooth, and that can lead to the tooth fracturing. Now, if the tooth breaks and it's above the gum line, a lot of times it's not that big a deal. Obviously, it can be painful, but a lot of times we can save that tooth with a crown. Unfortunately, if your tooth breaks and it breaks really far below the gum line or down near the bone, sometimes we can't save the tooth. And at that point, the tooth has to be extracted, and then we're either looking at a bridge or an implant or something a lot more involved. Whereas if you know you have a problem tooth and that might need that crown in the near future, delaying it could lead to a lot bigger problems down the road. The second reason why you might not want to wait is because if you're doing crowns for aesthetic reasons, crowns to make your smile prettier or to make your smile look better, a lot of times waiting can make the whole process a lot more complicated. Because sometimes if there's just one trouble tooth or one area that's made, let's say it's slightly turned or rotated or discolored, or it's impacting the way your smile looks, if you can address it with just 1 or 2 teeth at the time, that's a lot less involved process. Sometimes if you wait too long, you start getting shifting or breakdown of those adjacent teeth, and all of a sudden now you're having to adjust all the teeth in the smile zone, whereas before that problem could have been solved with a more minimal plan. The last benefit to getting a crown on a tooth when you realize it first has a problem, in addition to those small cracks leading to potential of a tooth fracturing, one of the other issues is that if you have cracks or breakdown of the tooth or decay that leads to a tooth needing a crown, if you put that off, sometimes that decay or those cracks can reach into the center part of the tooth where the nerve is, and that can involve a root canal. One of the issues with that is post root canal, sometimes you have to do more involved treatment plan than just a simple crown like you had before. And also you have to worry about the process of going through the root canal prior to getting the crown. Whereas if the tooth is on the borderline and you can protect it with a crown ahead of time, sometimes you can eliminate that need for a root canal and further problems. So that's not to say if you have a problem with a tooth or concerned about a tooth, you should immediately get it crowned. There are plenty of times where we have patients come in after their normal hygiene checks and we see some issues and areas of concern. And a lot of times we have that discussion with, hey, this tooth is looking like it's breaking down a little bit. It's okay for now. Let's keep an eye on it. You don't need a crown. And there are other times where we say, this tooth needs a crown. Let's get you scheduled. If you need to go on vacation the next week, if you've got big plans, you need to push it off a little bit. Generally speaking, that's not going to be a problem. The most important thing is to have a good dialogue and conversation about the timeline and how long we can put off putting a crown on that tooth to protect. I'm Dr. Langston, prosthodontist and owner of Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia, and I'm here to help you watch your mouth.
Down in Brookhaven, with a smile shining bright, Dr. Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.